My experience at this program has been incredible. I mean, it's been life-changing. I think going from being a pediatric resident where I didn't know anything to be able to grow and nurture my skills with the help of the wonderful faculty that's here, as well as now having the privilege and honor of being able to serve the residents as a chief resident, has been some of the best years of my life.
Our pediatric residency program at UPMC Children's Hospital is led by extraordinary pediatricians and educational scholars. What sets this group apart is their selfless dedication to the training objectives of our residents.
We have a volume and variety of patients that's almost unmatched in pediatrics across the country. You're going to know what you see, and so if you see a ton of patients with a variety of conditions, from the common to the unusual, you're gonna learn a ton of pediatrics. We really feel like that is the foundation of a great Pittsburgh pediatrician and drives the educational experience in our program.
We are the only inpatient pediatric provider in a very large geographic region. We also get patients who come here internationally for very specific care, and that allows us to have a wide variety of experiences with patients and families from all kinds of different backgrounds, from all different kinds of language experiences, and incredible diversity, not just of populations, but of patient problems and concerns.
I knew that I would get the best clinical training here. I knew that bread and butter pediatrics was coming to Children's Hospital of Pittsburgh, but I knew that other complex cases were coming too, and that after finishing training here, I would have seen pretty much everything that I could see in the realm of pediatrics, and I would have all the skills that I would need to continue to be a lifelong learner.
I really like how we get to rotate on different rotations like GI, neurology, hematology, oncology. And then as we're rotating in those, we're learning directly from the specialists themselves. Our attending is the gastroenterologist, our attending is the oncologist. It makes it such a good learning experience because then you're really learning from the people who are doing the research in the field and making those clinical decisions every day. It's very different from where I did med school, where it was a smaller program, and so we had to do consultants instead of being able to learn from these experts directly.
We have a tight-knit family of residents here who are complemented by fellows and faculty who are passionate about education. This is a hospital with an amazing tradition and experience of excellence in pediatric residency education, and we have leaders in many fields here who are going to be on the floors with residents and teaching them along the way.
One of the things that was really important to me when I was deciding where to go to residency was which residency program was going to prepare me to be successful, both as a pediatrician in the community, as well as succeeding in my board exams and all of my certifying exams that come after residency. I think one of the best parts about this program is that you're seeing such a wide variety of cases that there's nothing you haven't seen by the time you finish your residency here. And both that clinical exposure as well as the committed didactics to board-style questions and case-based learning are really what make us successful when it comes to taking the American Board of Pediatrics certifying exam.
Our noon conferences are designed around the content specifications for the American Board of Pediatrics. The same percentages of different subspecialties that are represented on the American Board are almost identical to the percentage of lectures that are provided here in those subspecialties. We cover everything that's on the American Board, and we also include in almost every single noon lecture different prep questions that direct people to focus on the topics that are going to be important for those board preparation experiences.
I would bet that we have one of the best conferences in the entire United States of all pediatric residency programs. Every Friday we get to do Zitelli rounds, which is where we get to work through a case as residents, where we get to call consultants. They'll stand up in the room. We'll be like, can I call GI? And then GI will be like, hey, that's me. And then they'll actually in real time give you what labs you should order and what you should be thinking at that point. We get to look at radiology slides, and we have a radiologist go up and read those in front of us. It's just so fun, and I feel like it's a great style to work through cases and learn that way.
There are lots of great pediatric programs out there, all of whom give you excellent clinical training and the tools to go on and do wonderful things with sick children in your life. But I knew from my interview here with Dr. Andy Nowak and Dr. Kate Watson that this was a place that I wanted to be at, and that these were the people that I wanted to work potentially the rest of my life with.
I think the greatest strength of our residency program is the family we've built here. I know you're going to hear that 100 times when you talk to anybody from our program, but it's Everybody says it because it's true. That is the greatest aspect of this program.
It extends beyond the residents, it extends beyond the program leadership, it extends beyond the attendings. Every single person at the Children's Hospital of Pittsburgh is so committed to our learning and our growth and our well-being, from the staff that works at the cafeteria to the people that mop the halls, as well as up to the chair of our pediatrics department. Everybody is committed to seeing us thrive and seeing us grow.
I love the program. I'd never stepped foot in Pittsburgh before I matched here, and I've been blown away. One of my favorite elements of this program is the physical space. The Children's Hospital is stunning. It's 9 floors, and it's very clear that it was all designed for kids. So everything is colorful, and there are toys everywhere, and there's beautiful art on the walls, and people running around and playing all the time. And it makes coming to work a more positive experience when people are having fun around you all the time.
So as a program director, it's similar to being kind of like a mom, but you're a mom to 128 residents. And so as proud as we are of our trainees and the work that they do here in the hospital, we are equally as proud when each one of them successfully graduates on their own individual path towards becoming a pediatrician, whether that be a general pediatrician or a hyper subspecialized pediatrician.
Because for us, nothing is more important than individualized training pathways that help our residents achieve the targets that they think are most important, so that they're ready to pursue whatever next steps in their career might be, whether it's fellowship experience, or to engage in primary care, or to move into public policy, or practice the law. Our residents do amazing things with their careers, and they're made possible by the expert leadership of our residency program directors.
Our curriculum is really designed for a pediatric resident to grow throughout their 3 to 5 years of training. We're going to start you out on teams, primarily on the inpatient side, where you're going to learn together with your senior residents, your fellows and attendings. And as you transfer over time, you're going to gain autonomy and independence in our program. And finally, in the final years of your training, you're going to be the leader of the team. And you're going to be the one responsible for education of junior learners, but you're also going to be preparing yourself to start a career in pediatrics and advocate for children.
I am one of the attendings, so I get the pleasure of being both a program director and a hospital medicine attending. One of the things that I love most about my job in wearing both of those hats is being able to see a resident go from intern year, where they're really just stretching out those clinical reasoning skills, to being a senior and effectively not even needing me on rounds.
The attendings that we work with here are deeply dedicated to our learning. They help push us to the right length so that we are learning and actively engaged in our patient care, and they give us an appropriate amount of autonomy.
It is all our plans, our decisions, and the attending is there to make sure nothing goes wrong, and we get to see how our training and our years of experience with the PHM division has started to influence our ability to practice independently.
The ideal resident in our program is someone who embraces teamwork and someone who learns by doing. Those experiential learners are going to be able to soak up all the incredible clinical experiences you have here and take that forward into your career to be an amazing Pittsburgh pediatrician. They're going to form some lifelong friendships, some lifelong relationships that are also going to be incredibly impactful for you personally and professionally. So teamwork and experiential learning are incredibly important in our program, and I think that's what makes the perfect resident here.
Pittsburgh pediatricians are leaders. They bring others who share their passion to form strong teams so we can solve tough problems. And as a testament to our Pittsburgh pediatricians, we try and keep as many as we can in our fellowship programs, in our primary care practices, and we hope they'll join our faculty. They're exceedingly well trained and really ready to engage in any type of career that they choose.
We say this a lot. The city of Pittsburgh is cheering for our folks, cheering for our residents when they walk through the door. Our faculty and our fellows are as well. And that's an environment that's special and produces great Pittsburgh pediatricians. That's why I'd come to our residency.
Being a resident at this program has been one of the hardest things I've done, but also the most gratifying. There are long days and long nights, but I knew that at the end of the day, I was getting the best education and I was going to come out a stellar pediatrician. I'm so proud to call myself a Pittsburgh pediatrician, and I'm going to carry that name wherever I end up.